Fetal development. Presentation by Bibi Varghese and Beth Floyd. Introduction. Conception. Conception, defined as the union of a single egg and sperm, marks the beginning of a pregnancy. It includes gamete formation, ovulation, fertilization, and implantation in the uterus. Gestation. Gestation begins with conception and continues throughout birth and pregnancy. Fertilization is the union of the egg and the sperm to form the zygote, which then begins a rapid series of cell divisions, separating into the trophoblast and the embryoblast while traveling down the fallopian tube toward the uterus. Fetal maturation. The stage of the fetus lasts from 9 weeks. That's when the fetus becomes recognizable as a human being until the pregnancy ends. Changes during the fetal period are not so dramatic because refinement of structure and function is taking place. The fetus is less vulnerable to tetragens, except for those affecting the functioning of the central nervous system. A standard definition is 20 weeks gestation and birth weight of 350, 400, or 500 grams, but this varies by state. Fetal circulatory system. The cardiovascular system is the first organ system to function in the developing human. Blood vessel and blood cell formation begins in the 3rd week and supplies the embryo with oxygen and nutrients from the mother. By the end of the 3rd week, the tubular heart begins to beat, and the primitive cardiovascular system links the embryo, connecting stalk, chorion, and yolk sac. During the 4th and 5th weeks, the heart develops into a 4-chambered organ. By the end of the embryonic stage, the heart is developmentally complete. 4 weeks. Fetal heart begins to beat, body flexed, C-shaped, arm and leg buds present, head at right angles to body. 8 weeks. Body fairly well formed, nose flat, eyes far apart, digits well formed, head elevating, tail almost disappeared, eyes, ears, nose, and mouth recognizable. First indication of musculoskeletal ossification. 12 weeks. Fetal heart rate can be heard using a Doppler. Sex of fetus can be determined. Blood forming in marrow. Kidneys able to secrete urine. Nails appearing. Resembles a human. Head erect but disproportionately large. Skin pink, delicate. 16 weeks. Head still dominant. Face looks human. Eyes, ears, and nose approach typical appearance on gross examination. Arm-leg ratio proportionate. Scalp hair appears. Meconium appears in bowel. Sensory organs differentiated. 20 weeks. Primitive respiratory movement begins. Brain grossly formed. Heartbeat can be heard with fetoscope. Vernix caseosa appears. Lanugo appears. Legs lengthen considerably. Sebaceous glands appear.
24 weeks. Body lean but fairly well proportioned. Skin red and wrinkled. Vernix caseosa present. Sweat glands forming. Lecithin appears in amniotic fluid. Ability to hear. 28 weeks. Brown fat present. Eyes begin to open and close. weak suck reflex, lean body, less wrinkled and red, nails appear. 32 weeks, subcutaneous fat beginning to collect, more rounded appearance, skin pink and smooth, has assumed birth position, awareness of sounds, sense of taste, fingernails and toenails have formed. 38 weeks, skin pink, body rounded, lanugo on shoulders and upper body, vernix caseosa scant, fetus receives antibodies from mother. Multifetal pregnancy. Monozygotic twins. Monozygotic twins develop from one fertilized ovum, which then divides. They are the same sex. They are often referred to as identical, although genetically they are not exactly the same. The splitting of the one fertilized zygote does not necessarily cause equal sharing of genetic material. Dizygotic twins. When multiple mature ova are produced in one ovarian cycle, usually due to increased levels of FSH, they have the potential to be fertilized by separate sperm. This often results in two zygotes or dizygotic twins. There are always two amnions, two chorions, and two placentas that may be fused. These dizygotic or fraternal twins can be the same sex or different sexes and are genetically no more alike than siblings born at different times. In monozygotic twins, they are developed from a single egg, which was fertilized by a single sperm cell. Two fetuses grow in the same placenta, and they have almost identical genetic profile. They are always of the same sex. They can have the same physical and mental characteristics, and they are called identical twins. In dizygotic twins, they are developed from two eggs fertilized by two different sperm cells. Two fetuses grow in two different membranes. They have completely different genetic profile. They may be of the opposite or the same sex. They may look alike or be different, may behave similarly or differently, and they are called fraternal twins. Fetal circulation. In fetal circulation, the fetus is oxygenated from the placenta rather than by using its lungs. The fetal liver is not needed in utero because the placenta provides all the nutrients to the fetus. The placenta surrounds the developing fetus and is comprised of the amniotic fluid and the umbilical cord. The placenta produces the hormones needed to maintain pregnancy and performs the metabolic functions of respiration, nutrition, excretion, and storage. Maternal oxygen diffuses across the placenta into the fetal blood, and carbon dioxide diffuses from the fetal blood across the placenta into the maternal blood. In this way, the placenta acts as the lungs for the fetus. Amniotic fluid suspends the embryo fetus and serves to maintain a constant temperature surrounding the fetus, as a source of oral fluid and a repository for waste, as a cushion for the fetus to prevent injury, to allow fetal movement for musculoskeletal development, to prevent the amnion, which is the inner membrane of the placenta, from adhering to the fetus, and to prevent umbilical cord compression. The umbilical cord contains 2 umbilical arteries that carry deoxygenated blood from the fetus to the placenta, and 1 umbilical vein that supplies the embryo with oxygen and nutrients from the placenta, which is the maternal blood supply. Wharton's jelly is a thick substance that surrounds the umbilical cord, acting as a physical buffer to prevent pressure on the vein and arteries in the cord from interfering with fetal circulation.
Risk factors and intervention. Risk factors that can negatively impact fetal development and lead to complications include preterm labor, which can lead to fetal respiratory distress syndrome, premature rupture of membranes, which can lead to fetal infection, ectopic pregnancy, which leads to the inevitable loss of the fetus and possible rupture of the fallopian tube, polyhydramnios, which can lead to fetal congenital anomalies and abnormal fetal presentation, oligohydramnios, which can lead to intrauterine fetal death, fetal cord compression, and intrauterine growth restriction, nuchal cord, which can lead to fetal aphaxia, maternal diabetes, which can lead to a large for gestational age fetus or neonate, Rh or ABO isoimmunization, which can lead to a fetal hemolytic disorder known as erythroblastosis fetalis, maternal age younger than 16 or older than 35, which can lead to chromosomal abnormalities, teratogenic effects in utero, such as exposure to maternal substance abuse, alcohol consumption, chemicals, radiation exposure, and or infections, which can lead to congenital anomalies and or fetal or neonatal death. Smoking, which can lead to intrauterine growth restriction. Poor nutrition, which can lead to congenital anomalies such as neural tube defects from folic acid deficiency and IUGR. Therapeutic and diagnostic procedures. Abdominal and transvaginal ultrasound can be used to assess fetal growth and development, the fetal tissues, organs, fluids, and bones, and fetal maturity. Biophysical profile is used to assess amniotic fluid volume index, fetal breathing movements, body movements, fetal muscle tone, and fetal heart reactivity. Amniocentesis can be used to assess for genetic abnormalities or fetal lung maturity. Risk factors and intervention continued. Nursing assessment of fetal development include monitoring the fetal heart rate pattern. The normal rate is 110 to 160 beats per minute. Measuring the fundal height to assess fetal growth. Assessing risk factors like genetic, nutritional, age, behavioral factors. Nursing interventions pertaining to fetal development include reviewing with the mother the need to perform daily fetal kick counts for 3 60-minute periods a day, at least 3 movements within a 60-minute period. If no movements within 12 hours, the client should notify her primary care provider. Providing client education regarding fetal development and the importance of abstaining from behaviors harmful to the fetus. Providing client information regarding the importance of taking prenatal vitamins. For example, the folic acid helps prevent neural tube defects. Complications of fetal development include genetic abnormalities related to defective genes, transmissible inherited disorders, chromosome anomalies, multiple pregnancy, and ABO incompatibility. Congenital anomalies are malformations of the fetus that are present at birth. Intrauterine growth restriction is the failure of the fetus to grow at the expected rate. Macrosomic, large for gestational age, refers to a fetus or neonate that's larger than normal for age. And lastly, fetal or neonatal death.